Hi, my name is Mitch Ellinger. Today I'm going to discuss Hirschsprung disease. Some common symptoms and signs that we see with Hirschsprung disease is the failure to pass stool within the first 48 hours of life, something called abdominal distension where the belly gets large and hard and can become painful, sometimes fever, nausea, vomiting, also explosive foul-smelling poop. Another thing that can happen is enterocolitis. This is an infection of the colon. This disease can affect varying lengths of the colon, anywhere from 1 centimeter, which is the size of a staple, up until the whole colon, and sometimes including the small bowel. The most common length is short segment HD. This usually involves the rectosigmoid, where the colon joins up with the anus. Longer segments of this are less common. If your child has HD, they will require corrective surgery to remove the diseased bowel in order to help with the situation. Sometimes, when they have HD, they will need to perform rectal irrigations or have a colostomy or ileostomy performed in order to keep the patient safe until the corrective surgery can be done. A colostomy is where the surgeon takes the colon, and ileostomy is where the surgeon takes the small bowel. And they create an opening on the abdomen called a stoma, where a bag is placed over this opening so the poop can be collected within the bag. Long-term, most patients will require oral medications or rectal enemas or integrated flushes in order to help them stool each day. One side effect that can occur from HD is something called enterocolitis. This is an infection of the colon that happens due to the poop not being able to properly be removed from the colon as it should. If not treated, enterocolitis could lead to hospitalization, a hole forming in the bowel called a perforation, an infection of the entire body called sepsis, or even death. There are a couple different treatment options for enterocolitis. The first one is rectal irrigations and antibiotics. During a rectal irrigation, trapped gas and stool is removed from the colon using a rectal catheter and saline, which is a special salt solution. This process helps to empty the colon since it cannot on its own. These irrigations are usually done around 3 times a day, but can be done more or less often as needed. Enterocolitis is seen less often after corrective surgery is performed and as the patient becomes older. Now I'd like to talk to you about the HD action plan. There are 3 zones that we need to discuss. In the green zone, your child is doing well. Your child is stooling every day, eating and drinking like usual. Their belly is soft and flat. They don't have a fever and they're performing their usual activities. In this zone, you should keep taking your daily bowel medications and watch for signs and symptoms in the yellow zone. You should reach out to CCPR if you have any questions or concerns. In the yellow zone, your child is starting to have symptoms of being sick. Your child has 1 or more of these symptoms. Not stooling each day, they're having decreased output than they normally do, they're having straining or a hard time stooling, could have a foul or explosive smelling poop, their belly is becoming hard, bloated, and painful, they're not eating as much as they used to, they can have nausea, vomiting, and sometimes fever. If this is happening, we recommend that you start doing rectal irrigations 3 times per day. You should notify CCPR right away when you're able. You can call 614-722-4086 or reach out to us via email or MyChart. We recommend during this zone that you continue to take your bowel medications as prescribed and continue to watch out for signs and symptoms in the red zone. In the red zone, your child is continuing to get sick from the yellow zone. They may be sleeping more than usual and being difficult to wake up. They may be peeing less than usual as well. You could also see that they are drinking less or eating less as well. They may be fussy and be hard to console or comfort. If this is happening, we recommend that you go to your local emergency department or call 911. Please notify us when you are able by calling the number on the screen. If you cannot reach us, we ask that you call the on-call surgeon by dialing the hospital operator. Thank you for watching this video. We hope that you found this information useful. For more information, please visit the website on your screen.